Good morning. Our next topic is management or treatment in injuries. Everybody knows about the management of injuries and treatments. Everyone. Okay. Today I'm just going to start that manage or treatment of injuries. So this is everything know about the how to manage or treatment of injuries. So I'm just go through the one and two injuries treatment. First of all is abrasion. Abrasions management is first of all to clean the affected part with the fresh air. They pick out the dead tissues and then that might be sticking to the area or abrasion, and then use clean as well as the sterilize the goods to wipe the dirt from the affected part. Do it very gently so that the abrasion does not hurt much. Then dry the affected area with the clean piece of gauze. Then after that, the apply medical ointment so that uh, that so that the proliferation of bacteria does not take place. Use enough ointment so that it does not stick to the abrasion. Use a big piece of gauze for dressing. Then visit a doctor for proper dressing and tetanus injection, which is the required for the prevent for the wound from the causes and infection. The next one, the dressing should be changed as per the instruction of the doctor. So this is for the management. You know the management about this one. Now I discuss another one, that is for laceration. Laceration, you know that. So first we know what is laceration. Laceration is regularly cut in the skin. The management, so already you should know about the management, and then management, but I'm just going to give you the easy one. That's why, and I'm going to discuss about the what is inclinations. Inclinations occur due to the sharp edge of object of sports equipments. Then management know that if the wound is not deep, let the blood come out. In this process, the germ also come out with the blood. Such wound should be cleaned with the iodine, then tincture or spirit. Then after placing pieces of cotton on the wound, and bandage should be applied. In such process, it should not enter into the wound. In case of excessive bleeding, the bandage should be kept tight. If the wound is too deep, a doctor should be consulted immediately. So this is for the management of inclination. Now, uh, this the main thing as the sprain. The management or treatment of sprains. So there are the two type of treatments at there. One is called as price. One is called as mice. So price. So what is price? So price is a P for protect. Uh, P for price, P for protection, R for race, I for eyes, uh, C for compressions, E for elevations. So this is for the price. So I've discussed about the management of the price of Spain. So that is the price procedure should be followed as per for the first 24 to 48 hours after the injuries, depending on the severity. And price stand for the the protections, raise, eyes, compression and elevation. So protection is the injuries area of the victim from the further injuries by using a support of wearing shoes that enclose and support the feet, such as lace up. Rest, it is the very beneficial to have as much rest as possible in the early stage in the order to allow the wound to heal and avoid the temptations to move the injury spot in the order to see if it is still hurt. So for proper treatment and reduce the exercise and other activities completely, and have completely rest. Then ice should be applied directly on the area of injuries as soon as possible. It reduces the bleeding or swelling by swelling down blood circulation. It is also relax the injured area by reducing pain. Ice should be wrapped uh, in a wet cloth to prevent skin burn, and ice should be applied for 5 minutes for a small area like the waist, and for the 20 minutes for the large area at the time. Application of the ice should be done 4 to 8 times a day. Avoid cold injuries and for civil, and do not apply ice for more than 20 minutes at the time. When ice is removed, the skin should look pale. On the other hand, if the skin is red, then it's means ice has been applied for long time. And then in compression is an injuries ankle, or an injuries ankle, knees and waist, help in reducing the swelling as well as the bleeding. It is best applied using a form of pad over the side of the injuries with a scrapped around it to hold it in place, and compression should not apply around a whole limb. The compression should not be applied very hard as it may hinder blood and circulation. Then evaluation, if the possible, keep the injuries ankle and knee, elbow and wrist evaluated, or on the evaluated on a pillow above the level of heart to reduce swelling. So this is for the treatment of mice. And mice is a four type of procedure. One is mobilization, ice, compression, evaluation. So mice, one of the signs of inflammation from uh, gone, and heat and redness are reduced. The mice, the procedure should be followed until the injuries is heated, healed, and mice stand for mobilizations, ice, compression, and evolution. And mobilizations. Mysis mobilization is it can be stated by taking a injury part through its full range of the movement. Such movement should be avoided that cause pain. This will prevent the wasting of the muscle through lack of use. If any movement is done usually, then try to increase the range of movement gradually. If the basic function of the injury spot has been restored, start more exercise. It usually takes time for injured part to get back to its normal strength. So only a light and simple exercise should be done at first. If pain is felt during exercise, the exercise should be stopped immediately. If pain is felt during exercise should be stopped immediately. If the pain disappears within 20 to 30 seconds, the exercise can be continued with caution. The next one is eyes treatment. With eye should be continued for about a week according to the severity of the injuries. After approximately 4 to 5 days, heat treatments such as hot pad can be applied. It helps in stimulating the blood circulation to the affected area. Then compression, this should be continue for a few days, and after that it is not required. Then elevation should be done until all signs of swelling, heat and redness have disappeared. So this is for your Spain fries and miss mice treatments and management. So same thing as there. Strain also same thing as their price, protection, race, compression and evolutions. Then after that, management of treatment of the bone is there. The dislocation joints, lower joint, shoulder joint, and hip joints. So there, the management is then call medical help for immediately. Don't try to move the joint or place it back in the socket. Keep eyes on the spot for dislocation or control swelling, and sling or splint the affected joint into its fixed position. So this is for the management of dislocations. And then fractures management is there. Fractures management, everybody know the first of all they elevate the extremely and rest while the bone heals itself heals itself. Apply ice to the affected area for 24 to 48 hours. If pain persists, give some painkiller. If there is any need in immobilizations of the affected area, use splint. And when swelling is reduced after putting partial weight on the affected area, then crutches or walking stick may be used in the beginning. After 2 weeks, start putting normal weight. For 6 to 8 weeks, avoid the activity that causes stress fracture. Then start doing the activity slowly. And then I'm talking about the green stick fracture. Green stick fracture, you already know the green stick fractures. This is commonly for the found in children. Most of these fractures involve arms and legs, which require the immobilization to make a bone grow back together in proper and nature position. Removable splint is the most recommended one among children. The swelling that occur on the side of the fracture may be reduced with anti-inflammatory drugs, and pain can be relieved by taking pain relievers. Generally, it takes 8 weeks for complete bone healing. High impact activities should be avoided in the beginning. So this is for the kinesthetic management of the fracture. And then it's community fractures. So I'm just giving community fracture also in and then ubiquate bone fracture, when the bone is broken diagonally to the axis of the bone, humerus or femurs, that is called the ubiqual oblique bone fracture. The management of oblique bone fractures are there. So management is the method of the treatment of oblique bone fractures usually depends on the amount of the damage of the bone. If the damage is minimum, the plaster cast may be used to treat the fracture. However, it must be oblique fractures, surgical treatment is required if the damage is extensive. Mental metal rod or something screws are used for hold the bone in place. And then impact fracture is last one is that transversus fracture. Transversus fracture, it is a break of a part of one of the bones of the spine, so upper or middle part of the vertebra and limber. So transversus fractures, same thing is that. And I'm talking about okay, I'm talking about the management of this transversus fractures. Last one, if the injuries is limited to a break of the transversus process with no other injuries, or hospital care is not necessary, the medications for pain control should be given. Limit the various activities in intricate or multiple fractures or of break bone. There can be damage to spinal cord and may require operation. So there can be pain and stiffness in the back or weeks some weeks after transverse fractures, and complete rest should be given to the person. After that, the affected person should not join in any activities. Neck and back beards may also be helpful in reducing the pain and increasing mobility. And exercise should be done to improve motions and to strengthen back. So this is for the management of turn versus fractures. So all management of discuss. So students, if you have any uh, discussion, any queries about the fracture, okay, so we can discuss. I'm sending few clues of the fractures management so you can understand easily. Okay, so thank you very much.